would like to introduce the first speaker, Dr. Karin Pirc, the Medical Director of Maharishi Ayurveda Health Center, Badams, Germany. She was honored with the Global Hakim Ajmal Khan Award with the Best Ayurvedic Physician 2006, with an International Lifetime Achievement in 2013. And she is also author of 8 books on Ayurveda. And today she is going to speak on treating to 20,000 patients with Panchakarma. Dr. Karin.
So I had prepared a talk about 20,000 patients treated in many, many years. And the first thing is what you see here is our wonderful clinic. We have about 1,000 square meters for treatment rooms, doctor's rooms, and so on. And it's near here. I heard the Vaidyas will visit our place this week, so I heard the cooks are preparing for 50 more people, so I hope you will enjoy that. So the difference, I think, when you have a Western clinic or you have an Ayurvedic clinic in India, we need extensive education. You heard already from many speakers how important it is, also this morning, increasing the sattva of the people. So we have an extra education and supervision daily by the physicians. So when the patients come, for each patient, we have a full hour. And I always say this full hour is not needed for doing the therapy plan. Of course, we need an anamnesis and everything. But as we heard this morning, a very important part in the first hour for Western patient is upliftment. Because what they see is when they come, a sentence which I hear very, very often in my office is, my doctor said, this disease will never go away. So that is the first chance for me to make a joke with my patients. And I said, your doctor is completely right. It's completely right. It's only the second part of the sentence is missing. Because it means, my doctor said this will never go away, comma, with my methods. So, and that is what you have to combat. The patients come, normally but they come with long disease, chronic disease history. They went through all kinds of treatments and nothing really helped, so they're happy with it. And you really need some minutes at least to tell them this thing will help. And there's another second sentence I use very often in the practice, because they sit there, you know, they're really dragged down with all their complicated things which they have, and this, don't have a trust, this will really help. We just try this also. And then I tell them it's very, very difficult to go out here and not feel better. So to help them to really trust and really do everything which they have to do, because they have to do a lot of things. We have evening lectures, we have DVD series which they can look at. We have cooking classes, yoga classes. They can learn meditation. And we have also extensive going home recommendations. When they go home, it's another 3/4 of an hour at least to tell them not only which preparations, but to encourage them to do all the things which we all know and have heard a lot today, how much the improvement is needed with sleep, with other eating habits. Like we have a lot of vegetarian people and then they come, but now you have to tell them it's great, you don't eat meat so much, but please skip the cheese in the evening. And that's a really, really strong education because they all do this. So all these things we have to do. Okay, so this is just our yoga class. You see an idea of the cooking class, so it's very personalized and the people really like it and they book it. Then we have some studies which I collected from our dear colleagues from the US who were very busy in collecting data. And you see that the physical health symptoms by a questionnaire, whatever is there, it's improving. And that's our day-to-day experience also. The well-being is better after Panchakarma, energy, vitality, strength, appetite, sleep patterns, if we have heard, mind and emotions, all kinds of complaints, and the usefulness. So people always feel better after they went through the Panchakarma, and also the treatments are nice. I mean, if we would have the same results and the treatments would be strenuous, but they really love to do it. They would even come if there wouldn't be a help, because it's so nice to go through it. And the plus is, after that, you feel much better. And the results stay for a very, very long time, many, many months at least, even if they don't follow everything, what they normally don't do. But it's good, then they have to come back. So then you have the mental health symptoms. And that's very important to understand, because for a normal Western person, if you take out the ama out of the system, also the channels in the brain become better. And you see also the mind-body connection is always there. So it's not possible to just grow with Panchakarma, with your health. You also grow with your psychological well-being. So distress, tension, anxiety, depression, anger, hostility, fatigue, confusion and bewilderment, and that goes down and the vigor goes up. That's great. And even memory, we have your general intelligence, short-term memory, long-term memory, and alertness. All these things are improved with, I think it was 12 to 14 days of Panchakarma. Then we have a German study, decrease of total cholesterol before Panchakarma of 10 days. It was 203 in mean milligrams per deciliter, and it went down by 30 points. And yes, I have a nice anecdote to tell you. After I worked for 2 years in our clinic, I once went to the pharmacy who's selling Maharishi Ayurveda products, and he was really excited. He came to me behind the counter and said, "Do you know how much the cholesterol falls down from your patients?" So because he was doing it in the pharmacy, and he was really excited about this. So that was a nice story to see that even people from outside who don't know anything about it, they just see the results. Then we have, this is a wonderful study because it's a very, very needed study about the reduction of 10 environmental toxins through Panchakarma. And it was in a mean estimated about 58%, and DDT and all these dangerous things. And I mean, all practitioners, we know how much all the diseases go up, which are definitely due to all the environmental toxins in our day-to-day practice. And having something in Panchakarma which is actually able to reduce this again, it's unpayable, because it really prevents many, many other diseases. And then this is another one which I really love, because we talked to Professor Sharma who had done this study, and it's a nice story with it. He was testing the malone D-aldehyde, which is a compound which is showing that the cell walls are damaged by free radicals. And he did 2 measurements before Panchakarma, and then one in the middle and one in the end of Panchakarma, and he was really shocked. He told us, "I was completely shocked. You can see the graph, it's worse than before." So, but then he thought this can absolutely not be possible, because we know that the ghee which the people ingest, the oils which the people are treated with, they all decrease free radicals. So how can that be? And then he did another one, which was 3 months after Panchakarma, and then you could see this is really going down. And his interpretation was that first of all, the body threw out all these molecules which were damaged and replaced by the healthy ones. And I think that's at least as exciting as that was John presented this morning with the genes, that you really can see there is an improvement in the structure of the cell walls. That's that deep what we are doing with the people. Good, then we have the next one is reduction of biological age. So before and after Panchakarma, you could see after 3 months, I think it was nearly 5 years younger, measured by hearing thresholds, near-point vision, and systolic blood pressure. So you could also see it was a long-lasting effect. Yes, and then if we compare, in Europe, patients normally visit the Western doctor when they have acute health problems, whereas in our countries, in the other countries, it may be easier, they come with earlier stages. In our clinic, they very often come with quite late stages, but still then you can see big results, very good improvements by their health problem. We treat everything. This I brought to you just to see we have outpatient and inpatient. To cut it short, this was a person who had a diabetes 2, polyneuropathia, so he couldn't feel his feet anymore, he could hardly walk. He was blind by diabetic cataract. He took a little dosage of insulin and metformin, so it was really a strong case. He had hypertension and chronic diarrhea. Actually, he came because of the chronic diarrhea. That was his main thing. He didn't have an idea that we could treat the diabetes because, of course, this is an untreatable disease. Never goes away, as we all know. So he came with the diarrhea because even he took modern medicine, the diarrhea was still there, like 6 times per day. And I told him in 4 days it will be down to 1 or twice, which it was, of course, thanks to your nice preparations. And then I gave him the diabetes preparations also. And to cut it short, we even could, we reduced the insulin, the metformin, and the diabetes was not, manageable before. So with our Ayurvedic preparation, it was manageable. And after 2 years, I only have kept the Ayurvedic preparations to prevent polyneuropathia and further problems. And he could eat completely normal, and I would see this diabetes was completely healed. Non-healable disease. Here we have an inpatient diabetes, same story. Extreme obesity, hypertension, diabetes 2, BPH. And he started with 369 untreated diabetes, very rarely in our countries. And then 14 days of Panchakarma. We had 150, well, the diabetes was absolutely down. Blood sugar here, 126 compared to 369. And all the other parameters also good. And what I wanted to strive is the polyneuropathia reduced. This is something which we learn in the modern medicine. You cannot do anything if it's in that stage because the macro and the microangiopathia have damaged the thing. And it is not true. This is what we always see. It's definitely not true. Good for the patients. You can improve these things also. So this is for our foreign guests, that you have an idea what happens in Europe. So we have 1996, we had the Hufeland, I just translated it, Hufeland Register for Therapy Directions of Alternative Medicine. The Ayurvedic therapies were included because we could prove they are efficient in their therapeutic results, and also that substantial scientific studies as background have been there. We have 3 German health insurances reimburse Ayurvedic therapies when they are prescribed by a physician, and also you need an additional contract with the patients. We have about 1,200 facilities all over the German-speaking countries which offer Ayurveda in hotels, just little things sometimes. And we have the Relax Guide, that is an independent journal. They go around and incognito test the clinics, what they offer. And they said only 30 of those really offer substantial Ayurveda with good results. And we always get a good price for that. So, and then all over Europe, and I heard from Hungary, good news from Dr. Triguna at the beginning of the conference. So little Ayurvedic clinics here and there are there. But until now, nobody knows how good the service is, except the patients. They go there where the good service is for sure. And then you heard about the Schweizer Verband, that they had 2 professions already recognized by the state government. And education, we have the Middlesex University in London in conjunction with the College of Ayurveda. They offer Ayurvedic medicine masters in some years, so very profound knowledge. Then the European Academy of Ayurveda in Bierstein, they also offer Master of Science degree course, and it's accredited, which is important, by the Gujarat University and the London University. Then we have the Maharishi University of Management in the USA. Since many, many, many years, they offer already a bachelor for 3 years and a Master of Science for 5 years studies, full-time studies in Maharishi Vedic medicine. And now it's also available online for everybody in Europe. So you can have a Master of Science in Maharishi Ayurveda and Integrative Medicine. And then we have the Maharishi European Research University, also since many years, 1987, offered standardized, well-structured, basic and advanced training courses for doctors in Maharishi Ayurveda medicine all over Europe. And last not least, I want to tell you about the Mother-Baby program, which I have been the honor to work with, together with about 13 Western doctors and also Vaidyas, and they really went into the text. So we made a very long, structured education for health promoters and doctors who can learn this, which is about nearly 6 weeks of just this basic principles, and it was really a joy to see how deep they went into the knowledge. Sometimes week-long discussions about points which are not in accordance with the different texts, so there were long discussions. So until in the end everybody was happy to find a big package. They went into the text, they went into the Sanskrit. So this is something which we will do in more and more areas, I guess, so we can really offer something very valid. And make it short, we need more scientific studies also in the West, because we could see what Dr. Robert Schneider, he was able to move with just Western studies. I know the Indian studies are great. I went into many for our next advanced doctor's courses. They're really great. But somehow the Western people, they feel they need their own studies, so we have to make that possible in the future. Thank you very much.
Thank you, Karin, for a wonderful speech.